could see this look of emergency in his face and terror.
Something was wrong. I couldn't feel or move my legs.
We weren't quite sure exactly what was happening.
You know, watching your son hooked up to a million tubes and watching his body disintegrate, how do you explain that?
She went from a healthy little girl to a girl with one arm.
I didn't even want to go out just because I don't want people to stare at me.
I just wanted to be normal.
On this episode, two medical mysteries that defied the experts. When bizarre growths begin forming on Matt Horrick's body, his family is forced to face a horrifying reality.
You're not supposed to outlive your child. It's a parent's worst nightmare.
When Carol Kerpeel discovers a mysterious lump on her daughter's back, the 3-year-old is forced to undergo radical surgery. But it's only the beginning of a terrifying journey that will test both patient and parents in ways they could have never imagined.
I was numb. I could not move. I couldn't breathe. We were in this big world with no answers and a dying child.
We look at the doctors for what they can't. If diagnosis is a mystery.
High school sweethearts Carol and Fred Kerpeel got married in the summer of love, 1967. And quickly settled down in Peachtree City, Georgia. More than anything, they looked forward to starting a family. But that simple dream would soon turn into a major struggle.
I wasn't able to carry children, so we thought about adoption as our alternative, and we pursued it from there.
The adoption process is not an easy one, but after 10 long years, the Kerpeels finally bring home their adopted son, Derek.
This was what we wanted to do, was be a family. We became instant parents and an instant family.
Then, in the fall of 1981, Carol and Fred decide to go through the whole thing again. But this time, they adopt a baby girl who they name Laura Ashley Kerpeel.
When they put her in my arms, I just couldn't take my eyes off of her. She was beautiful. She had dark, beautiful, curly hair.
Derek is thrilled to have a little sister, and the young parents are delighted to finally have the family they've always wanted. But a few weeks after bringing Ashley home, Carol notices something odd about her daughter's tiny feet.
The large toe on each foot appeared to be much smaller than the rest of her toes, and a little bunion appeared on each toe. I brought this to the attention of the pediatrician.
But after giving little Ashley a thorough head-to-toe exam, the pediatrician assures the Kerpeels that they have nothing to worry about.
He gave me the answer that it could be a cluster toe, which is not uncommon. I wouldn't be concerned. We'll just say that her husband will have expensive shoe bills.
And just as the doctor promised, Ashley doesn't have any trouble learning to walk. In fact, she hits all of her milestones right on time.
As a toddler, Ashley was very precocious. She was adorable.
For the next 2 years, Ashley continues to thrive and appears no different than any other little girl her age. Then, one day in the fall of 1984, while she's fitting her daughter for a new dress, Carol feels something on Ashley's back that sends a chill up her spine.
I ran my hand along the back side of her right shoulder, and I could feel a very large, warm lump. It was full and red and warm to the touch. It was very scary looking. It was like someone had pumped air up into the right side of her body. I couldn't believe it.
It was as if you got bit by a wasp or a yellow jacket, but in a much, much bigger area. I mean, it was like the size of a man's hand.
I was so panicky, I just couldn't think of anything else but this lump on her back. So we went into the emergency room, we brought our child and said, here we are, please someone see her.
While the Kerpeels wait and worry, their little girl undergoes an extensive battery of tests.
Everyone wanted to come in and see who this little girl was with this mysterious lump on her back. There were so many doctors coming in and out of there, a lot of whispering, a lot of second guessing. So you're sitting there waiting and you want answers and no one seems to be giving you the answers.
The pediatric surgeon believes he can get closer to answering some of these questions, but only if he first secures a biopsy of the lump. Carol and Fred quickly agree. And when 3-year-old Ashley is wheeled into the OR, they're hoping the whole ordeal will soon be over.
After they finished with the biopsy, we were told to return home and that we would get a call that evening if the results came through.
That night, the phone rings, but the call brings more questions than answers.
He said, I just called to give you some news. She has infantile fibromatosis.
Infantile fibromatosis is a benign but aggressive tumor that usually appears in young children on the head, neck, or shoulder. They often grow rapidly and can invade the child's muscles, nerves, and tendons.
They explained that it wasn't a malignant cancerous tumor or anything like that. You know, it wasn't a major problem.
He more or less indicated that we're not going to do anything, we're just going to watch it. I couldn't quite understand what he meant by just watching it. You didn't watch tumors, you didn't watch cancer, you had surgery. And we looked at each other and said, maybe a second opinion would be appropriate.
Taking matters into their own hands, the Kerpeels immediately set up an appointment with an oncologist. Little do they know their world is about to be turned completely upside down.
The doctor said that infantile fibromatosis needed to be dealt with through surgery. This was not anything that you watched.
The oncologist orders a CAT scan. And when the findings come in, alarm bells go off. It appears as though the growth has already spread into Ashley's right arm. And if he doesn't surgically remove the tumor immediately, it will continue to grow. Suddenly faced with this drastically different opinion, Carol and Fred aren't sure what to do.
He kept saying, you don't know until you get in what you're going to find. I can tell you that we'll probably just need to remove that muscle.
We thought about it and agreed to bring Ashley in and to do this. That was the family decision.
The next day, Carol and Fred are a bundle of nerves as they count down the hours to the surgery. But they do their best to keep it together for the sake of their little girl.
There was a song that she used to sing so well, You Are My Sunshine, and she was singing that before they came to take her away. We got her to sing because she was a little curious as to what was going on. We told her someone was going to have to take her.
She got a little bit terrified. The person that came in was in their surgical outfit, and I picked her up, and I was the last person that actually handed her over.
She was crying. She didn't want us to give her away, she kept saying. Well, she's got to do it. She's got to go. And that was the last we saw of her.
As the medical team begins the surgery, Carol and Fred settle in for what they know will be the most agonizing day of their lives. But just halfway into the 5-hour procedure, one of the surgeons comes barreling through the OR doors.
His eyes were wide open, his hands were very red and stressful looking, and I could see this look of emergency in his face and terror. And it was like, did he do something wrong? Did something happen? And he said, oh, Mrs. Kerpeel, where's your husband? I said, well, I just sent him upstairs a little while ago. And he said, well, I have no time to wait for him. We need to talk right away. He was telling me, we've gone through this surgery as far as we can go. I have dissected and dissected. He said, and this tumor has gone up under her arm, around her arm, down her back, around her side. He said, it's just amazing. I have just got to take the arm and shoulder in order to get it all. I kept having him repeat this to me. Do I understand what you're saying? This whole arm has to come. And he said, yes. He said, and I don't have time to wait for your husband. I have to have your permission. We need to get this arm off. I've left her in a terrible state. We've got to get this thing off.
Diagnosis is a mystery.
Matt Horick was a fun-loving 7-year-old enjoying every minute of his childhood in Point Reyes, California.
Matthew was very active, very curious. Below our house, there's a big field with a little seasonal creek going through. Him and his friends would go down there for hours and hours.
And there was lots of space for me to run around and play with my friends, so I spent most of my time outdoors.
Usually we'd camp for a week at a time. Eventually we got a boat and then camped even more often.
We did a lot of boating together. He just seemed to come alive when he was in the water. You know, took to it just like a fish.
I was very sports oriented. Growing up, I played soccer and baseball and football.
I was a soccer coach and his dad was a Little League coach. He loved just being part of the teams.
Matthew was a healthy kid, but his toes were talked about every time he ever went to the doctor. And they'd look at his toes and they go, oh, that's odd. And they just said nothing to be concerned about.
Matt seems to be the picture of health. But one sunny day in April, something strange happens that will change his life forever.
I was playing in the yard outside my house with some of my friends, and I bent over to pick something up, and I felt a sharp pain in my hip. And then I couldn't straighten myself out, and it was very scary.
Matt was just kind of L-shaped, bent over. He couldn't stand back up. I had absolutely no idea what was going on.
It was very excruciating pain, and I knew something was wrong.
Matt was only 7, so for him not to be able to straighten back up at that point was deeply concerning. I decided to take him to the emergency room.
Doctors are taken aback by Matt's condition and immediately perform a series of x-rays.
It frightened me because all of a sudden all these specialists who were looking at me, examining me, talking about x-rays.
As his parents wait for the results, they're relieved to see that Matt is slowly able to straighten himself out. But their relief turns to shock when the doctors explain what the x-rays reveal.
They discovered that something was drastically wrong with my hip, and I was diagnosed with hip dysplasia.
Hip dysplasia is a condition in which the top of the thigh bone, or femur, pops out of the hip socket. Severe cases result in walking difficulties and chronic pain.
They said, Matt's going to have a hard time running and jumping, and that hurt him to hear that, and for me to hear that.
I was worried about how it was going to affect, me playing sports. Growing up very active, to not be active was really not a possibility to me.
I was scared when they told me that the socket would have to be rebuilt.
But the doctors wanted to wait for his bones to mature in order to do the surgery, and hopefully it would be his early teens.
Unsettled by the turn of events, the family heads home. And over the next few years, Matt bravely endures the troubling condition.
As he was getting older, you could see Matt's hip coming out to the side a little bit more. And his limp was getting more prominent. And it hurt as a parent to see that happen.
Matt was stiff a lot through the hips, and he couldn't run. And he definitely had a short stride when he walked.
I had limited movement in my hips, but it felt like bone grinding on bone. Sometimes the pain was so severe, it would shoot through my entire body. I remember being very frustrated because I wanted to be active, but I couldn't. At that age, it was very devastating.
Then, to make matters worse, Matt's home life soon takes an overwhelming emotional turn.
When Matt turned 12, his mother and I divorced. Matt's mother and I just had differences that we couldn't reconcile, so we just had to split and go our own ways.
I knew that they weren't getting along, but we were always very close as a family. It was somewhat of a blow to me.
I had total custody of him. So Matt and I left Point Reyes and moved to Petaluma.
The move was very sudden, and I had to leave all my friends behind. I had to move to a new town. It was a big transition. I was not used to living in a city. The school was much larger than I was used to, and I was made fun of a lot because of my limp. I was very self-conscious. That was particularly a hard part of my life. And I became, essentially withdrawn. I mean, to me, I just wanted to be normal.
Going into junior high school and your peer group is completely gone and your security's completely gone, you're thrown into a school that's triple the size of where you're used to going to, was very devastating for Matt. Being a new kid having a limp, Matt wanted that operation, thinking that it would cure all, and he was looking forward to it.
Desperate to walk without the limp, Matt dreams of undergoing corrective surgery. And in the spring of 1997, just weeks before Matt's 15th birthday, his doctor clears him for the operation.
They opened about an 8-inch incision on the side of my hip. They pulled apart the joint and shaved off my femur to make it fit into the socket and put 3 pins to hold my femur in place.
It was major surgery. As a parent, you don't want your child to go under a knife at all, even though you know it's going to help. It's still a very scary thing.
8 hours later, the surgeon pronounces the operation a success, and Matt begins a long road to recovery, confident that his problems are behind him.
I was on crutches for about a total of 10 months, and I had to basically learn how to walk again. Gradually, I worked off of them and was able to walk without any pain.
Seeing him moving fine and getting up and down by himself, and it was a great thing. It was a great thing, After that, he was very active. When we would go boating, he'd be out there swimming and tubing.
I ended up discovering wakeboarding. It was the most natural sport I'd ever done. Once I was up, being pulled behind the boat, I remember just being free. Nothing else around me really mattered.
Then, the following summer, when he's 16, Matt goes on a camping trip with his father. And while he's wakeboarding, he loses all control.
Everything just happened so suddenly that I didn't even have time to close my eyes or brace myself in any way. I went essentially face first into the water, and my neck snapped back. I'd never had a fall that serious, and I remember once I came to the surface, my first thought was something was wrong. I couldn't feel or move my legs.
Diagnosis is a mystery.
A team of doctors has just discovered that a growth called fibromatosis has invaded a huge section of 3-year-old Ashley Kerpeel's right side. The chief surgeon is now convinced that their only option is to amputate the little girl's entire arm and shoulder.
To get it all, he had to take everything. There could be no waiting for my husband to come back downstairs. Do you understand me, Mrs. Kerpeel? He kept saying, do you understand me? And I just found myself agreeing, shaking my head yes.
Carol came and got me and said that the surgery was so invasive that it got to a point that there were basically just ligaments holding her arm on, and that they would have to take the arm off. It wasn't a matter of a decision whether we should or we shouldn't.
5 hours later, the surgeon pronounces the amputation a success. And when they're finally allowed to see Ashley, it takes everything in their power just to keep it all together.
I couldn't quite focus. I knew that I was going to have a child with no arm, but at the same time, the demon would be out of her body. And so I had to focus on that.
We're trying to be the strong parents and look at the upside of things. You do what you have to do at the time.
She was on a lot of machinery. I remember hearing the sounds of the pumps, and where her arm and shoulder were was a big pillow.
The next day, the Kerpeels are told that Ashley needs to begin physical therapy immediately.
She had to get up and start walking right away. So they brought a little doll's carriage in and they asked her to push it down the hall. And before we knew it, she was pushing that stroller down the hallway.
And I remember distinctly the doctor saying, "It seems like she'll be more of a fighter."
Over the course of the next 2 weeks, Ashley exceeds everyone's expectations. And the doctor soon decides that she's strong enough to go home for the Christmas holidays.
Having Ashley home was wonderful. She's a bright, wonderful child.
But as little Ashley begins getting used to life with one arm, Fred and Carol are having a much harder time adjusting to how the world sees their daughter.
She went from a healthy little girl to a girl with one arm. She was pretty astounding to look at. 1/4 of her body was missing.
As the harsh new reality sinks in, the young parents vow to do all that they can to help their only daughter lead a full and productive life.
Ashley was still Ashley. There was no doubt about that. I mean, she was a darling little girl.
Slowly, the family begins to reestablish a sense of normalcy, but it's not to last. One morning during the spring of 1985, Carol is getting Ashley dressed when, to her horror, she notices an all-too-familiar bump on the left side of her daughter's back.
There was this big, huge lump, and it was just like the other side. And I immediately panicked because I thought, oh, no way is this going to happen again.
In a state of panic, Carol rushes Ashley to the closest emergency room. But after performing a thorough exam, the on-call doctor assures the anxious mother that there's nothing to worry about.
He kept saying, there's nothing on that side. That swelling is probably due to the fact that she's overusing her left arm. When he said it was overuse, I totally believed him, and I think it's because I wanted to believe him.
Carol breathes a huge sigh of relief and takes her daughter home. Sure enough, within a week, the swelling in her left shoulder starts to go down. But just to be on the safe side, they begin bringing Ashley to pediatric orthopedist Dr. William Schmidt for routine checkups.
The Kerpeels seemed like they were coping with everything they had been through very well, probably more than I would have.
But during the first couple of visits, Carol begins to notice an alarming new pattern of behavior.
She would run to the elevator to hit that button, and she couldn't reach that button no matter how hard she tried. I said, come on, Ashley, you can do it. Get that arm up there. And she kept saying, but I can't. It hurts. If I do that, it hurts.
After all that Ashley's been through, the Kerpeels can't bear the thought of anything else going wrong.
She demonstrated her lack of motion of one shoulder and one arm, and I just was very suspicious.
Little do the Kerpeels realize that during this seemingly routine visit, their life is about to spiral out of control again. Concerned by the development, Dr. Schmidt orders an X-ray of Ashley's left shoulder. And almost as soon as he sees it, he realizes that something is very wrong.
I obtained an X-ray which revealed some calcification in the paravertebral muscles. Calcification is the laying down of calcium and bone in the muscle. Fibromatosis does not, as a rule, develop any calcification. At that point, I didn't feel that she had fibromatosis.
I couldn't believe he was saying this to me. We had just gotten an okay to continue with our lives.
My first reaction is seeing that she had undergone the amputation based on the diagnosis of fibromatosis. To say I was overwhelmed was putting it mildly. The findings to me were very definite, but I just was hoping I might be wrong.
Diagnosis is a mystery.
While on a camping trip with his father, Brian, 16-year-old Matt Horick has just had a terrifying high-speed accident on his wakeboard. And now he can't feel his legs.
I turned around and he was yelling, "Get me out of the water, get me out of the water."
My dad had to pull me into the boat because I couldn't lift myself into the boat. From my neck down, my whole body was hurting and tingly, and it was just any kind of movement I did was shooting pain all the way through my body.
I was concerned, so I asked him if he wanted to go to the doctors, and he said no. It was just sore. So we decided to wait and see if it had felt better.
By the time they get back to camp, Matt is able to walk on his own. But the pain is agonizing.
The rest of the day, I just relaxed at camp, trying to move as little as possible. I was sore from my neck down for several days.
But a week later, when Matt's mother is visiting, she's stunned by a bizarre change in her son's body.
We were unloading camping supplies in my driveway. And it was a hot day, so I had my shirt off. And I remember moving stuff back and forth from the car. She came rushing up, told me to turn around.
There was a protrusion close to his spine. It was a hard lump on his back that was not normal.
She told me that there was one large bump stretching from both of my shoulders into my mid-back. We both kind of stood there confused. I had my shirt off all weekend and it wasn't there before.
I was scared. There was, something was going on.
Doreen races Matt to the nearest hospital, where doctors immediately perform a CT scan. While they're waiting for the results, Brian arrives. Within the hour, the findings are in, and they are nothing short of shocking. Matt has a large tumor on his back.
When they told me Matt could have cancer, it was devastating. It was hard. It was, painful. You're not supposed to outlive your child. It's a parent's worst nightmare.
My first reaction was disbelief. Everything was happening so suddenly. I was afraid.
With no time to waste, Matt is transferred to the oncology department, where Dr. Kenneth Leung takes over his case.
When I first walked in, I examined him, and then I noticed the mass in his back. It was rock hard, cannot be moved. Our first thought in something just came on that quickly is cancer. In order to make a correct diagnosis, we have to do a needle biopsy on the mass.
The results turn Matt's case on its head.
Based on the pathology, there was no evidence of cancer. The pathological diagnosis is fibromatosis.
Fibromatosis is a condition in which benign tumors develop. They may cause vital organs to malfunction.
Once I was told that this is what it was, I felt a little bit of relief because I knew how to treat it.
We started his chemotherapy, and we expected his tumor to slow down or actually disappear with the chemotherapy.
Watching your son hooked up to 1 million tubes and having a pump full of chemicals and watching his body disintegrate and his hair fall out.
It was hard because it's totally out of your hands. It's in the doctors and it's in the Almighty's, and you don't have anything to do about it except be there for him and make sure he's comfortable.
But after 6 long weeks of treatment, the tumor has not decreased in size. And when Dr. Leung performs another CT scan, he is amazed by what's happening in Matt's body.
We couldn't believe there were 2 big muscles along his spine that were becoming bone-like structures.
The soft tissues of Matt's muscles are ossifying, actually transforming into bone.
It's not in the normal progression of fibromatosis. We have to go back to the literature and do some research.
They started to second guess their initial diagnosis. That was the scariest part to me, not knowing what it was.
After poring over the medical literature, Dr. Leung comes across a condition that just might explain Matt's bizarre symptoms. However, most patients have an odd defect. To confirm his hunch, he has to check one last thing.
When I examined Matt's toes, they were abnormal. His toes almost looked like an L shape, which was a hallmark of this condition. We were very confident that Matt had fibrodysplasia ossificans progressiva, or FOP.
Fibrodysplasia ossificans progressiva, or FOP, is one of the most disabling genetic conditions known to medicine. In healthy individuals, genetic signals instruct the body when and where to form bone. But in patients like Matt, the gene responsible for sending the signals is damaged and causes sporadic but completely uncontrollable bone growth. Ultimately, patients are trapped in a second skeleton.
FOP is a progressive ossification of your soft tissues.
Dr. Leung explains that the first sign of Matt's disease was visible at birth. Although doctors noticed his abnormal toes, they failed to recognize their significance.
Growing up, I knew that my toes were different, and I never understood why.
But it was all too clear that Matt had a skeletal problem when his thigh bone, or femur, popped out of his hip socket.
Many patients with FOP are born with shortening of the femoral head. This abnormal bone formation is just another part of this genetic mutation of FOP.
Diagnosis is a mystery.
Just as Carol and Fred Kerpiel are beginning to come to terms with their daughter Ashley's amputation, Dr. William Schmidt has uncovered new evidence that suggests the amputation may have been completely unnecessary.
The more I reviewed my findings, I felt very saddened for the Kerpiels and Ashley.
Dr. Schmidt is confident that a strange calcification that's developed on Ashley's spine proves that she's suffering from an extremely rare and devastating disease. He takes a deep breath and picks up the phone to tell the Kerpiels exactly what he's found.
We were getting ready for our annual Memorial Day picnic, and I was in the kitchen getting a few things, and the phone rang. And it was Dr. Schmidt. And he sounded so sad to me, and I thought, what is this about?
I told her that after reviewing all the information I had obtained from evaluating Ashley, I felt that she had fibrodysplasia ossificans progressiva.
Fibrodysplasia ossificans progressiva, or FOP, is one of the most disabling genetic conditions known to medicine. In healthy individuals, a genetic signal instructs the body where and when to form bone. This begins as the skeleton is formed in the embryo. In patients with FOP, the mutation of a single gene alters these instructions, triggering sporadic and unnecessary bone growth, or ossification, in muscle mass throughout the body. In essence, the patient begins growing an extra skeleton.
As the patient progresses on X-ray, one can see the development of bone in areas where there should be no bone, in unusual areas. In looking at Ashley's X-rays, the bone was developing more progressively and certainly becoming more definite for FOP.
I never heard of this $1 million word. I had to write it down to make sure I could even spell it correctly. I asked him to explain everything to me, what I needed to know.
To begin with, Ashley first exhibited signs of the debilitating disease when she was just 2 months old. What another doctor considered cluster toes was, in fact, the initial onset of the disease.
The patient with FOP, as a rule, definitely has shortening and abnormal development of the great toes in each foot.
And then, over time, the disease just took on a life of its own.
As the patient develops bone in the muscles, they will develop these areas of swelling that are tender. I think at the time that she had her first symptoms in the right shoulder, that was probably her first flare-up.
He goes on to explain that the latest swelling in Ashley's left shoulder is a clear indicator that the muscles in her remaining arm are beginning to transform into bone as well.
Eventually, her body would become very rigid, and basically, they become immobile. I couldn't believe I was hearing this. It was just so unbelievable.
As the Kerpeels struggle to come to terms with a devastating diagnosis, they can't help but wonder why no other doctor was able to put the pieces of the puzzle together.
On the biopsy, fibromatosis can look a lot like FOP. So it can be a very difficult pathological diagnosis to make because it was so rare. It just was not expected.
The Kerpeels' next step is to reach out to the world's leading expert on FOP, Dr. Fred Kaplan. And their first question is one they can hardly bear to ask.
I wanted to know, did the arm come off for no reason?
The amputation was done to save her life at that point because of the enormous amount of difficulty that was encountered. I don't think that the surgeons planned to do an amputation when they took Ashley into the operating room. Nevertheless, she came at it with an amputation and a catastrophic event that changed the rest of her life.
There was a misdiagnosis and there was a surgery that shouldn't have been done. And it was just absolute devastating information to get.
Unfortunately, almost 90% of FOP patients around the world are misdiagnosed. Not only misdiagnosed, but often have dangerous, painful, unnecessary procedures that actually worsen their condition.
In fact, research has proven that any sort of trauma or invasive procedure in an FOP patient can trigger catastrophic explosions of new bone growth.
Once the bone forms, it stays there. Sometimes spontaneously, but often after minor bruises and injuries, the FOP gets activated again. It's like a bear that's sleeping. Sometimes it sleeps, and sometimes it doesn't take much to wake this bear from a hibernation, and that bear becomes very angry, attacks other skeletal muscle, and eventually replaces almost all of the body's skeletal muscles with extra bone. This is a complete metamorphosis.
Unfortunately, it is a metamorphosis that will continue for the rest of Ashley's life. There is no known cure or treatment for FOP.
At that time, there was very little known about this condition, and we had no other medications to administer these patients.
Without any way to stop the second skeleton from growing, Ashley's prognosis is grim.
The ultimate progression of the disease can lead to an early death. And the way that usually occurs is that chest expansion is limited and the patient has difficulty ventilating and expanding the lungs to get the adequate oxygen necessary.
I remember crying uncontrollably. I asked him how long he thought she had to live, and he said he thought it would be anywhere between 2 and 10 years because she was progressing so fast. I was numb. I could not move. I couldn't breathe. What was I to do? We were in this big world with no answers and a dying child.
Diagnosis is a mystery.
While Dr. Leung suspects that Matt's FOP was dormant for a while, the violent wakeboarding accident sent the disease into overdrive.
FOP can flare up at any time and any age of a patient. But ossification most commonly is preceded by some kind of trauma to soft or connective tissues. It is very possible that the accident that Matt had in the lake set off the lump in his back.
Little did Matt know that the sport he loved could leave him incapacitated. Every accident or fall would have made his disease irreversibly worse.
Any trauma can cause flare-up of their condition. We suggest that patients to avoid trauma at all costs.
But while Matt can limit his activities, the terrible reality is that as the deadly disease progresses, it will slowly trap him inside his body.
Patients eventually get more and more ossification around the rib cage that will limit their ability to take deep breath.
Because their chests cannot properly expand, most patients' hearts and lungs begin to fail.
Just hearing him say that, it was just too hard to comprehend and put it all together right off the bat.
Unfortunately, there is no cure for FOP, and there is no specific treatment for FOP other than anti-inflammatory medications for some pain relief.
To find out there's no cure, that broke my heart. You know, there's no possible way you can work this out. It's just a whole feeling of helplessness. You can't do anything about it.
"16-year-old Matt Horick is struggling to understand some horrifying news. He has just learned he is suffering from FOP, an extremely rare, crippling, and often fatal disorder. His body is essentially growing a second skeleton.
Even though I was somewhat relieved that we finally found out what it was equally as painful to learn that it would get worse with time, and that, you know, for fear of progressing the disease, my active lifestyle was over for good.
Over the next year, Matt bravely does his best to accept his physical limitations, and anti-inflammatories ease his pain. But excess bone continues to form in his back.
My back started to become bent. It was very uncomfortable to walk.
He was 6'1", 170 pounds, really healthy. And within 6 months, he was crippled over to about 5'8", about 120 pounds.
As the Horrocks struggle to come to terms with Matt's fate, they can't help but wonder why no doctor was able to put the pieces of the puzzle together sooner.
FOP is very tricky to diagnose because it's extremely rare. There are only about 700 confirmed cases in the world, so most doctors will never see this in their lifetime. Also, in the early stages of FOP flare-up, these masses can look like fibromatosis, so 80 to 90% of patients with FOP are misdiagnosed initially.
Today, Matt Horick is 28 years old and living a remarkably full life. Determined to help others deal with their own challenges, he's busy studying for a bachelor's degree in psychology. But more than anything, he relishes his family.
In the years following my diagnosis, my dad ended up getting remarried to my stepmom, Nina, and having my sister, Danielle. The birth of my sister was extremely important to me, just being able to see her grow up and, you know, spend time with her, going through that whole ordeal, make sure you can appreciate those people that were there to support you.
It took me a long time to figure out that there's different paths of life that you can travel, and that he's going to have to travel that path, less traveled. So he's taught me to look at life in a different way.
Matt is my hero. He's been through a lot, and he has so much to offer in respect to giving other people hope.
I try to appreciate the moment I'm in right now, and even though I know I may have a bad day, I just try to get through that day, and hopefully tomorrow will be better.
Diagnosis is a mystery.
When Ashley Kerpeel was 3 years old, she was diagnosed with FOP, an extremely rare, crippling, and often life-threatening bone disorder, and her doctors didn't expect her to live past age 10. But as it turns out, Ashley is a survivor who has been beating the odds for almost her entire life.
From a very young age, and I never knew anything else besides having FOP.
Unfortunately, coping with her disease has often been made worse by the pain of being different.
It was very hard. Sometimes I didn't even want to go out just because I don't want people to stare at me.
A lot of kids were a little bit afraid of her because she was so different looking.
In an attempt to help their daughter fit in, the Kerpeels decide to get Ashley a prosthetic arm when she enters 2nd grade.
I wanted her to be normal, so I would send her to school in this little arm, and I felt very fulfilled because I could see a whole body.
I didn't have any muscle to operate anything, so this huge piece of plastic wrapped around the back of my neck underneath my left arm up on my chest. I went to school one day and I came off the school bus and the arm was turned around and like hanging off my back.
She'd say, "Hi, Mommy," and I'm looking at this arm behind her, and all the kids are kind of and I said, "Ashley, your arm, quick." And I'd bring it forward. And she'd say, oh, okay. And she'd pull it forward. And I'm thinking to myself, she's wearing this arm for me, not for her. I said, Ashley, let's throw this in the garbage. Okay.
Throughout her adolescence, Ashley does her best to lead as normal a life as possible. But the disease is slowly ravaging her fragile body.
I've had flare-ups on and off my whole life. I lost mobility in my left arm slowly. I used to reach my forehead and comb my hair, and then over time, I wasn't able to anymore.
I wish there was such a thing as a mild case of FOP, but there really isn't.
Today, Ashley is 26 years old. Her left arm is essentially frozen from the elbow up. She has limited movement in her neck, and her right hip and leg are fused in a semi-sitting position. She now wears a custom-made shoe, which helps compensate for the irregular shape of her leg.
As much as I hate FOP and what it does to our body and the pain it causes, I can't imagine my life without it. I wouldn't be who I am if I didn't have this. I can't imagine not being me.
Despite the disabling disease, Ashley lives a very active life. She works for her father at their home office, coordinating corporate conferences, and spends most of her free time volunteering. The Kerpeels remain hopeful that during Ashley's lifetime, researchers will find a cure. In just the last 2 years, Dr. Fred Kaplan and his team have identified the gene that causes FOP.
It was a gene that encoded a switch that was involved in bone formation. Our job now is trying to understand the exact reason that the switch is behaving that way and to design the right drug to prevent that switch from causing this second skeleton to form.
When the cure happens, it's going to be a huge, huge deal for all of us and the kids to come that haven't even been diagnosed yet, that they won't have to deal with what we've dealt with.
Because we have Fred Kaplan in our lives, I sleep better at night. The fact that they found the gene gives me all kinds of hope. And there is hope for Ashley, indeed. She looks for the day when she will have a lot of freedom as far as her body goes. If I had to sum it all up for Ashley, I'd have to say to be continued.
I tell a lot of people there are a lot of things in life that you can't change, but there's one thing you can do, and it's just live with it.